Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, Navigating the Marketplace During Healthcare Open Enrollment, is presented by Gabriel Ortiz Gallego, Certified Application Navigator Outreach Specialist. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of the presentation. At Atlantic Health, we've combined expert care with comfort and convenience to offer a thoughtful mammogram experience that prioritizes your health and well-being. With the advanced breast imaging technology, we ensure greater accuracy and comfort. Plus, we make booking stress-free and easy online scheduling and flexible appointment times at more locations near you. Because this isn't just a mammogram, it's a mammogram with more peace of mind. And with that being said, I will now turn things over to Gabriel.
Hello, everybody. Good morning, good afternoon, good evening, whenever it is that you are watching this, wherever you're watching from, however you're watching from, whether it's through your phone, computer, desktop, anything. Right now, the time is 5 p.m. So for those who are in attendance right now, good afternoon or good evening. I don't know, whatever you want it to be. Thank you, Ashley, for the beautiful presentation. My name is Gabriel Ortiz Gallego. And with that, just to give a brief introduction to myself, I am a certified application navigator / assister, and also an outreach specialist. I do things such as webinars, go out to tabling events. We also do enrollment events. I'll be going a little bit more into detail about that later on, but I work for New Jersey Citizen Action Education Fund under the ACA Health Enrollment Program. And we're gonna speak today a little bit on a topic that is called open enrollment. Maybe some of you already heard of it. Maybe some of you haven't, whether it's the first time you're hearing about it. This is a lot of information to take in, so feel free to ask any questions in the Q&A box. Feel free to do whatever it is. We'll get to those questions later on as we're wrapping up the presentation. And without further ado, let's begin. Open enrollment application. Before we go through the whole process of everything, we just want to give a huge shout out to the state of New Jersey Department of Banking and Insurance. It is through them that our organization is funded, and we are able to do things such as host these webinars and be able to give you guys this kind of information. So a huge acknowledgement and shout out to them for everything they do for the funding of this grant. And let us begin with New Jersey Citizen Action Education Fund. Now you're probably asking yourself, what or who is New Jersey Citizen Action Education Fund? Well, in abbreviated terms, the NJCAEF is a statewide grassroots organization that fights for social, racial, and economic justice for all New Jersey residents. Now, what does that mean? Well, when you think of a nonprofit organization, you're probably asking, well, what does that nonprofit do? Luckily for you, we are wraparound services. And with everything that you can see in the slide right here, we provide a handful of things. So we're more than just ACA enrollment program, which helps with applying via Get Covered New Jersey or New Jersey Family Care. But we are also a free unbiased education enrollment, assisting New Jersey residents in applying for affordable healthcare options, helping people find what best suits them financially, economically, and just for their day-to-day living. But aside from the health enrollment aspect of things, we also have a free tax preparation department. So if you, your family have a household income that is under $65,000 a year, you know that you are eligible for free tax preparation through our organization. We will be providing the information of where we're located later on, so hang on to your seats with that. But aside from helping with the taxes, we also help people apply for ITINs. If you or someone you know is looking to apply for an ITIN or renew their ITIN, they can always come to us and we can help them with that process. We also have a financial coaching department, which is just one-on-one coaching experiences where they help out with helping you manage your finances, budgeting, helping you prepare for your future a lot better. And with that, we also have a first-time home buyer counseling. Those looking to buy a home for the first time can come through us, and we can help them throughout the process of everything. With that being said, we also have a fair housing, knowing your rights, educating people into knowing what housing rights they have. If they have a case where they're being racially discriminated or in any religiously discriminated, for example. If there is a case, we help them with their case, provide them the resources that they may need to take it to court or anything that may deem uh, suitable for them. And also, we have an NJCA oil group. We have negotiated discounted prices on heating oil, acts as an information resource, and advocate for New Jersey heating oil consumers. And if you want more information on that, you can visit us in the website that is posted below at njcaef.org. Now, when I said that I work for the ACA health enrollment program, maybe it crossed your mind and you said, what does ACA stand for? Well, ACA, as it says right there, stands for the Affordable Care Act. And what does that mean? Well, just to give a few examples, it covers people with pre-existing health conditions such as pregnancy without giving anyone more bills. Anything is less charge, without more charge, in other words. But it also provides free preventative care, giving young adults more options for health coverage, more affordable options. That's hence the word Affordable Care Act. It protects your choices of doctors, and if you do lose your employment, if you lose your job or anything like that, it does protect you as well from employer retaliation. Now, as we move forward with the rest of this presentation, I want you to ask yourselves these questions. I know there's going to be a lot of questions for me, but I want to ask some questions. I want to give you some questions to keep in mind. And to better understand your purpose of healthcare, ask yourself these three questions: why, what, and how? Why do I need health insurance? Why is it important? Well, you might be saying to yourself, Gabriel, I am in good health. I have no issues. I've never had to go to a doctor. I've never been in a hospital before in my life. I'm perfectly fine. So why do I need health insurance? Well, aside from the fact that it is part of the law that everyone needs to have health insurance, life is never guaranteed. And one thing we know about life is that things can happen in an instant. And I've had the unfortunate mishap of that happening to me with my own personal experiences as well. Life can be grand, life can be great health, and then in a blink of an eye, you can be going up to the hospital because you got in an accident, or you just realize that there's something going on within your health system, your body is failing you. God forbid that is the case for anybody, but that is one of the things that leads us to what the importance of having it, the why of health insurance. Now, ask yourself this: what do I need? What do I want from my health insurance? Am I looking at just going for checkups? I don't usually go to the doctor. Okay, let me just I just need to go for an annual checkup, maybe go every 3 months, a seasonal checkup. Okay, or maybe I need to see a specialist. I've been feeling a pain in my stomach and it's not going away. Maybe I need to go to a specialist. These are the kind of questions you ask yourself when you're trying to choose a health plan, trying to find the best option for you. And of course, the biggest question for all of us is how much will it cost or how much can I afford? That depends on you. Only you know your income. Only you know what you're capable of spending to protect yourself, to give yourself, the benefit of having affordable health insurance and seeing doctors, whether you go frequently or not. So always ask yourselves these three questions when going through the process of I need health insurance or I need to find a better affordable health insurance plan for me and or my family. Now, there are two types of, well, I wouldn't say types, but there are two different resources that you can go for when when applying for health insurance. One being known as NJ Family Care, which is also known as Medicaid. and the other being known as Get Covered New Jersey, formerly known as Obamacare. A lot of people tend to ask when I speak with people, they usually still refer to it as Obamacare, but it is known as just Get Covered New Jersey. Two things to keep in mind when you're applying for New Jersey Family Care, it's all year round. You don't have to worry about a specific time. Oh, well, I don't need it right now, but maybe down the line, I'm going to lose my job or something. I need to know if I can apply for New Jersey Family Care. Of course, anytime throughout the year, if you have income, if you lost your income, if you're no longer eligible under the Get Covered, you can apply for New Jersey Family Care. It is zero to low cost health insurance for children. If they're under the ages of 19, they are automatically sent to New Jersey Family Care for the most part, depending on income, of course, but for the most part, kids under the age of 19 should be eligible for New Jersey Family Care. And for adults who are within the New Jersey Family Care income grid, which we'll begin to a little bit more later on, they may also be deemed eligible. Or if you're age blind or disabled, you also fall under the category of New Jersey Family Care. And you can see right there, there's a link where you can apply for New Jersey Family Care. And there are 5 different options that you can choose from. There's 5 different health plans. Now they all function the same for the most part. However, when it comes to, just choosing, whatever you feel good with choosing, if you know that a specific provider or doctor you go to accepts Aetna or Fidelis Care, you may want to go with that one. Or if you just want to go with the common options such as Horizon Blue Cross Blue Shield, United Healthcare, those options are there for New Jersey Family Care when choosing a plan. And Get Covered New Jersey, as you see right there, open enrollment is starting next month, November 1st, and it is until January 31st. And with Get Covered New Jersey, it's a wraparound service. You do receive financial subsidies, so it's not like you're going to be paying $500 out of pocket. I mean, hopefully that's not the case. There are some very rare cases where that can be, but you do receive financial subsidies, which is just help from the government themselves, which help you pay and make these insurance plans more affordable. So you can find one that may be $0. You could find one that's $20, $50, $100, whatever it is that suits your needs. Medical and dental insurance is provided for the most part. And there's the website as right there down below. And Get Covered New Jersey actually has 6 plans now. They have the Horizon Blue Cross Blue Shield, AmeriHealth, Oscar Health, Aetna CVS, and Better WellCare, and United Healthcare plans. Now, as discussed before, I mentioned open enrollment period, starting from November 1st, next month, until January 31st of 2025. Now, when you're applying for open enrollment, you want to keep these things in mind. How do you know if you're eligible? Well, you will know that if you're uninsured in the state of New Jersey, if you're uninsured dependent residing in New Jersey, if you're no longer determined eligible for New Jersey Family Care, if you received something in the mail recently or within a time period that from New Jersey Family Care stating that you are no longer considered eligible for New Jersey Family Care and you have to apply through Get Covered, that is when you know you can apply. And if you're a citizen or lawfully present non-citizen, you are eligible for New Jersey Family Care. And with recent news, I believe this was the news that came out last month, but DACA residents are now eligible as well for throughout the open enrollment period and to apply for Get Covered New Jersey. As mentioned before, Get Covered New Jersey, one-stop shop. It's very user-friendly, very easy to maneuver around, very easy to use. Free assistance with financial subsidies to help pay the premium. Premium is just the monthly fee that you may pay for your insurance if you have to pay. As mentioned before, there are plans with $0. There are plans with $10, $20. But it all comes down to the income and household size, which is something that we'll discuss as we continue moving on with the presentation. So just keep one thing in mind. If you enroll for 2025 through the months of November 1st up until December 31st, just know that for 2025, your coverage will begin starting January 1st, the very first day of the new year will be when you're eligible to use your plan. But let's say you have to apply during January instead, the new year. I applied January 15th, let's say, for example. Just know that if you apply within the 1st of January to the 31st, your insurance will be activated starting on February 1st, so the following month, and vice versa. If you applied on February, on the 4th of February, let's say, just know that your coverage will begin starting March. And if you apply during March, your coverage begins in April, and so on and so forth. That's just the basic understanding of things. Hopefully, that's not too confusing. Now you're probably asking, Gabriel, I'm I'm fine. I don't need health insurance. What if I need it during the months of February, or let's say in May, I lost my health insurance through New Jersey Family Care. You told me open enrollment is just till the 31st of January. Well, we have something called the special enrollment period, where you're eligible to apply for Get Covered New Jersey as long as you meet the special requirements, or also known as the qualifying major life events. That could be loss of job, maybe you've lost all your income, or maybe you're even making a lot more than before in your job. Death of a spouse, change in immigration status or citizenships. A lot of people have been receiving their permanent residence card or work authorizations card. So they do become eligible to apply through Get Covered New Jersey. Just recently married and or divorced, birth and or adoption of a child. If you're pregnant, if you're moving from another state to New Jersey, and it's also income based as well. If you are below the 200% federal poverty level, you are eligible to apply during the special enrollment period. It's important dates to keep in mind with special enrollment: 60 days from the major event. You have 60 days to apply. So if let's say you lost a loved one in March, just know that you have within 60 days to apply for Get Covered New Jersey to reorganize everything, fix your plan, choose a better health plan. But if the major event happens in March and you're waiting until, let's say, August to apply for through the special enrollment, there are loopholes around it. There are ways to work around it. However, we always want to make sure that we give that time period 30 days to 60 days. 30 days is based off income, but 60 days after a huge major life event, such as a loss of a family member or moving into the state or anything of that nature. Now, advanced premium tax credits. You know how I spoke about financial subsidies before? Well, this is the financial subsidies. They're known as APTCs, which is tax credit you can take in advance to lower your monthly premium. So we've probably known in the past where insurance plans are $200, $300, $500. With advanced premium tax credits, they help you lower those depending on your household income size and your household size is what determines how much APTCs you will receive. Remember when filing your taxes to be honest about everything that you that you put in there to avoid a penalty. Remember to report your income and household changes to avoid a penalty as well. Just keep these three things in mind. Number one, the amount your premium tax credit depends on estimated household income for 2025, not for this year, not for the year before, but for the upcoming year. If you have a lower predicted income, you may owe money, which is why it's very important to be as accurate as possible. If there's a higher predicted income, you may receive advanced premium tax credits back. And more importantly, number three, you do not have to accept all or any advanced premium tax credit, which is something that when working with a navigator, we can explain a lot further into more detail. American Rescue Plan Act of March 2021. It's an increased amount of financial subsidies. 9 out of 10 New Jersey residents will qualify for financial subsidies, and no one pays more than 8.5% of their income. Just know that is based off the Inflation Reduction Act that was passed in 2022, and it has extended the financial help has extended up until this upcoming year of 2025, which is a special thanks to the Biden administration. Now, Get Covered New Jersey renewals. Maybe you already have Get Covered New Jersey. You already have an account. You already have your insurance. With open enrollment coming up, there's a few things to keep in mind. Some will be automatic, or for most people, their insurance will renew automatically. Any information that needs to be updated within the month of this October up until December of 2024, you must resubmit an application. That just means if there's a change in your household size, maybe maybe a family member is no longer living with you, they moved out, or maybe your income has changed drastically. You're no longer making 55K a year, you're making 60K now. You want to make those little changes. They may be minor, but they play a huge role into the renewal process of things. Always double check your premiums, make sure that you're paying an affordable amount for your insurance, and double check your deductibles as well. New Jersey Family Care, we already got out of the bubble of Get Covered New Jersey. Now with New Jersey Family Care, it's NJ's Medicaid program. As mentioned before, it's free to low-cost insurance for children who are under the age of 19. If there are any undocumented children that are coming into the States from their respective countries, as long as they are under the age of 19, they can also apply to receive health insurance. For adults, as long as they meet the requirements of the income grid, they can also apply through through New Jersey Family Care. And if you're aged, blind, or disabled, or in long-term care, or adults with Medicare, they can also apply through New Jersey Family Care. The eligibility for New Jersey Family Care, as expected, you must live in New Jersey. You must be a New Jersey resident. It does come down to the household income and size as well. U.S. citizenship, or if you are lawfully present for 5 years or more. Something that is starting to happen now is we're getting a lot of asylum people or Cuban parole coming in from Cuba or Venezuela or wherever it is, their respective countries. So they are also being deemed eligible for New Jersey Family Care. Children, as mentioned before, can enroll regardless of their immigration status, whether they came last year, whether they came yesterday, 2 minutes ago. As long as they are here in New Jersey, they are eligible to apply through New Jersey Family Care. Just important to keep in mind, there is a waiting period of up to 90 days. New Jersey Family Care has progressed a lot, but they have been backed up as well with so many cases, so many people applying for New Jersey Family Care. So the wait time may be a little long, but it's definitely worth it. It's a yearly renewal. You always want to make sure that you're up to date with your health insurance, make sure that everything's still active and working. If income is higher than poverty line, you may pay a premium. Very rarely is that the case, but there are cases where some people do have to, and it does not count as a public charge. Now, as mentioned before, the family income grid. This is the New Jersey Family Care income grid. As you can see right here, it talks about the family size, so a family of 1, family of 2, family of 4, 6, and so on and so forth. When you're looking at, let's say you're just one person, you're living alone, you're going to school, you live in you're doing part-time and full-time at school. You're making, let's say, let's just say, because I'm doing a part-time, $1,500 a month. You would be eligible for New Jersey Family Care. Now, if you're a family of 4, let's say, and you're bringing roughly anywhere from just under 3,000 a month in a family size of 4, know that you are also eligible. So these are the kind of things that you want to keep in mind. To looking at the grid, the 3 things to keep in mind is the family size, the household income on a monthly basis, and your child, if you have children or somebody with a disability. You always want to keep those things in mind when saying, okay, I want to apply for New Jersey Family Care, but am I eligible? This is how you would know. After enrollment, so let's say you already filled out the application, you did it with me, you did it yourself. With New Jersey Family Care, after 4 to 6 weeks, you want to check the status of your application. I know it said there's a 90-day wait period, but you want to be on top of it no matter what. You want to make sure that you're receiving letters in the mail. You want to make sure that they're staying in communication with you, that you've already provided everything that you could, that they've given you a policy number, because with that policy number, that is how you will be able to submit any requested documents. Policy number must be written on each document that is requested. Those documents can be, but are not limited to, copies of the last 4 paychecks, or a letter from your employer, or any documentation of legal presence in the country. So make sure whether you send it via fax, whether you send it a hard copy, or you go on your New Jersey Family Care account and you decide to send it electronically, make sure that with those documentations that you send, you are adding on the right corner, top right corner, left right corner, wherever, your policy number, which is provided to you once you've received the mail from them. And also choosing your HMO plan, your Horizon, your United Healthcare, your Aetna, your any plan, AmeriGroup. You want to make sure you're choosing the right plan that suits you, one that you would feel comfortable with, of course. And with Get Covered New Jersey, after the application is filled, you have up to 90 days to submit any documentation that is being asked of you to continue receiving those advanced premium tax credits. So you can still hold on to your insurance, but if they're asking you for, let's say, a birth certificate or a social or your permanent residence card, you have 90 days to provide that electronically. It is on the application, the dashboard of the application, so it's pretty easy to maneuver around. You have 90 days to send that over so that it can be approved and that you can continue receiving the financial subsidies, the APTCs, through them. Always remember, select a health and or dental plan. Just know that those two things are separate. You can choose a health plan but not choose a dental plan. You could choose a dental plan but not choose a health plan, or you could choose both, whatever best suits your needs. And the premium is always paid on the first of every month. So just make sure that you're set up your automatic pay, or if you don't like automatic pay and you rather pay it on your own time, make sure to pay it before the first of every month so you don't get penalized for it or get told that you're no longer covered. As mentioned before, you can apply all year long through New Jersey Family Care, and with Get Covered, open enrollment from November 1st to January 31st, but special enrollment is from the 1st of February up until October 31st. So you can also apply all year long through Get Covered New Jersey. It's just the circumstances will change during special enrollment. Things to remember when you're choosing a health plan: know the name of your provider, know which insurance plan you're choosing for yourself, review your plan benefits. It's easy to say, well, I have health insurance, I'm just going to go to the doctor. I'm going to go to my primary, get a checkup. Well, with Get Covered New Jersey, sometimes there is a copay. You will have to pay a specific amount out of pocket. If you do go to a primary doctor, yes, you do have insurance. Maybe you're paying $0 a month in premium, but the copay is going to be $20 per primary visit. Just review your health plans accordingly. You never want to be caught off guard. You don't just want to choose a health insurance and say, well, I'm going to choose this one because I need health insurance. No, just make sure you're reviewing your plans, your benefits, understanding what it is that you have in your insurance plan. To do that, you can always review through your dashboard on Get Covered New Jersey website, or you can just go on the link of the provider. So if you choose a Horizon health plan, you can always go on the website for Horizon, create an account, and you should be able to get all your information there. And consider using providers in network and out of network. In network meaning within New Jersey, out of network is out of the state. We're beginning to wrap up. So you're probably asking, Gabriel, do you work alone? Are you a solo? Are you a lone wolf kind of guy? No, I have an amazing group of people and an amazing team. As you can see right here, our supervisor, Gabrielle Escribano, huge shout outs to her, an amazing person. full of energy and very can give you all the information that you need. Carla Zepeda as well, our lead navigator, she helps out a lot with um, attending to clientele, attending to people who come to New Jersey Citizen Action and need help with health insurance. An amazing individual, myself included, certified application counselor, alongside another member, Melanie Machuca Pereira. So 3 girls and 1 guy. That's how it is. But an amazing group. Couldn't ask for a better team. There is a way to get in contact with either one of us. If I can't help you, then Melanie probably can. If she can't, then Carla can. And if Carla can't, of course, Gabrielle can. So we're all here as a team. We're all here to help during the open enrollment process, during the special enrollment, even for New Jersey Family Care. We are here to help you. This is our ACA Health Enrollment team. Keep in mind, one thing that we've been getting a lot is with a lot of people who are residing in New Jersey come without any documentation. They're not documented. They're not here. They don't have any legal presence, or they're in the process. They don't have their work authorization yet. They're in the process. But these people also need to be attended to. These people may also have health conditions that need to be checked up on. Well, the good thing about New Jersey is that we have federally qualified health centers. And what that means is that there's a wide range of medical, dental, and behavioral health services that include primary care services, special care services, dental, or pharmacy services. So if you know of somebody who could benefit from this, it all comes down to your county. So if you live in Union County, I know there's one in Elizabeth, I believe in Third Avenue, that is a federally qualified health center that you can go to, or you can recommend those people to go to so that they can receive the checkups that they need or the care and services that they're looking for. There's also, I know there's about a couple in Plainfield as well. It all comes down to your county. So if you ever want to check, you can always go on Google and search up federally qualified health centers in Essex County, in Bergen County, in Middlesex, in Union County. And from there, you should be able to get a handful of federally qualified health centers that can help out you or anyone that may be deemed eligible for it. This is the contact. If you want to get in contact with me, there's my personal contact right there, Gabriel at njcitizenaction.org, or you can reach me at my phone number at 908-808-1007. Or if you want to get in contact with anyone else within the ACA enrollment team, you can always message the Get Covered at njcitizenaction.org, or our ACA hotline, the 888-654-3893. And one of us can get in contact with you eventually if you reach out. If we don't reach out, leave a voicemail. If you prefer to do it via text message, feel free to do that. WhatsApp as well. When it comes to the email, we typically respond within a 24 to 48 hour business hour period. So feel free to reach out to us however you feel most comfortable. You can also find us in our social media accounts as long as you search at NJ Citizen Action on Facebook, on Twitter, and on Instagram as well. With that being said, if you need any information on any of our other wraparound services, the free tax preparation, the financial coaching, first-time home buyer, fair housing, or NJ Oil Group, I'll leave the contact there. The information is there as well as our ACA health enrollment. You can take a screenshot. You can just pause the video whenever you're watching this. This is all the information that we have provide here at New Jersey Citizen Action. It has been a huge honor. Thank you so much, Ashley, for having me.
So I'd like to say we appreciate you all for joining us today. We kindly ask that you take a few minutes after today's webinar to complete the program survey. A link to the survey has also been added to the chat for your convenience. A special thank you to Gabriel for dedicating your time and expertise today. If you have additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499, option 3. That concludes today's webinar, and I hope you have a great evening.